So, talking about my experiences with healthcare, I am fortunate that I have health insurance. Um, with that said, I typically try to visit doctors, whether it's a primary care physician or a specialist. I typically try to visit doctors that are in network with my insurance. That is to avoid out of pocket costs. And so I typically go through my health insurance website where I can narrow down whatever specific doctor I'm looking for by geography, by within, a certain mile radius of my home. Um, and that gives me a pool of names, right? But I'll be honest, it's not always how close the doctor is to me. There are other factors I take into consideration as well. But typically you want to try to find a doctor that's somewhere around where your home is. So I start there. It gives me a pool of names. Um, and then to further narrow it down from there, I'm one of those people. I look at reviews online. I look at comments that people have made about visiting this doctor and the experience that they've had, and were they pleased with the evaluation and the overall experience they had visiting the doctor. Um, with that said, and I and I'll be honest, being, a minority female, I also typically look at gender for certain issues, and I look at um, patient and staff diversity. I think, because that's just not something I want to confront when I'm in a vulnerable place. It's not it's not something that I want to have a negative experience with as far as my gender or my race. So I look at the diversity within the patient and staff office. Um, so after I've narrowed it down, I typically, those are the factors that I typically consider, the comments, and like I said, the other factors, gender and diversity.